Women do kind of accept that you are going to have some changes as you get older, but then there's also a lot of fear using hormones and, using hormones appropriately. And I'm like, this is actually super, super safe. It's super beneficial for you. And it's not only fixing your symptoms, it's helping to prevent other major illnesses down the line.
What is this thing, perimenopause?
We all know about menopause, right? We're all just like, oh, we're going to have normal periods until we're 55 and then boom, it's going to stop. We're going to stop cycling. We're going to be in menopause. I'm assuming anyone over the age of 35 is in perimenopause. And we're starting to see some hormonal fluctuations, typically a drop in progesterone and testosterone. I have patients that have 2 periods a month and the periods are now 7 days. Now they're bleeding really heavily. Now their estrogen is maybe getting really high. Their progesterone's getting really low. I had a patient pass out in the shower. They're starting to get a little more anxious, a little more irritable, a little more moody. And I always ask a really good clarifying question. I was like, okay, so you feel tired? They're like, I'm exhausted. And I was like, do you feel physically tired, mentally tired, or emotionally tired? Bioidentical hormone replacement therapy is so safe. Not only is it treating your symptoms, but it's also protecting your heart, your brain, your bones. It's not only fixing your symptoms, it's helping to prevent other major illnesses down the line. There's so many things that these hormones can do to protect our bodies that I feel like the benefit far outweighs the risk.
Dr. Tade.
Hello.
Welcome. This is the Generational Health Podcast, just so you know. I don't even know if you knew the name of this podcast.
I honestly didn't.
Yeah. So the Generational Health Podcast, really what I've been trying to do with this is help people understand like what they can do today to optimize their health.
Mm-hmm.
I've talked with like business professionals and medical professionals like yourself, parents, other people who've gone through just different medical things in their life or health issues, and how that kind of translates into kind of that next generation and how we help.
Amazing.
Kind of like, investing in not wealth, but your health longer term, generationally. So here we are.
Beautiful.
Thanks for coming in.
Thanks for having me.
I seriously love having you here. So you and I were just talking about
sexuality.
We did.
Yeah.
We were. But specifically, we were talking about just the changes that men and women go through over the course of their life, specifically with hormones.
Mm-hmm.
And I was saying that I think it's important that we kind of talk through this from the perspective of how husbands or spouses or partners can better understand what their other half is going through.
Right.
Because I think sometimes we take things really personally in a relationship when it might just be hormones. You know what I'm saying?
Okay. But human sexuality is multifaceted, right? It can be hormonal. It can be emotional. It can be, do you feel like you're getting to spend quality time with your partner? Because anytime I'm having like the libido discussion with a male patient or a female patient, I'm like, well, where do you feel like it's lacking? Is it like a physical attraction? Is it you're physically not responsive? Are you, just so tired? You're so burnt out. You don't even want to have sex. Do you feel emotionally supported? Are you spending time? Are you going on date nights with your partner? Because sometimes that's the trick. Mm-hmm. Most women, and you were kind of saying this earlier, men, your hormone levels are like the same, right? It's like every day of the month, it's like the same, right? Your libido is generally the same almost every day. Women generally every month have a huge fluctuation in their hormones. And generally most women have the highest libido around ovulation, right? Mm-hmm. Because that's also biologically when our bodies are meant to reproduce. It's like when we're the most fertile. And then, of course, then we go into the few weeks before your period, which a lot of women don't feel super, super sexy during that time or want to engage in any sexual acts. So, I think a big part of that is like, okay, I always check women's testosterone. But a lot of women, especially as we're getting into perimenopause, menopause, the first 2 hormones that drop are what? Do you know?
Progesterone.
Yes, and testosterone.
Testosterone drops with first. I was going to say estrogen, but
So progesterone will start to drop, then testosterone, and then finally, as you're getting closer to menopause, the last
Estrogen.
hormone to drop is estrogen. So if they're starting to have changes in libido, sometimes just giving them progesterone will change their lives.
Hmm.
A lot of women are in a state of fight or flight constantly, where they're constantly like, they're working, they're taking care of the kids, they're doing, a million different things. It's hard to get into that like rest and relax where you feel
Mhm.
sexually receptive. So giving them progesterone can kind of flip them out
Just
of
kind
that
of
like
calm down.
chronic state of fight or flight, calm them down. And then if they need it, give them a little testosterone. If their labs are low, if they're feeling kind of low energy, low motivation, give them a little testosterone. And that usually will get them into a really good range. I also love oxytocin.
Hmm.
I love it.
I love oxytocin too.
Yes.
I wonder how effective it is with most patients. I don't know. You've probably prescribed it to lots of patients.
hmm
I'm curious how many patients on average come back and say, "Oh man, this was great stuff,"
I
versus, "I don't know that I felt anything different."
I dose it pretty aggressively. I
Hmm.
take like 200 IU's at night.
Okay.
And I don't always prescribe it for libido. I give it to people that have their difficulty falling asleep, staying asleep. Really, that formulation. If you see oxytocin in a libido combination, that oxytocin is not going to make you feel super horny. It's going to help relax you.
Hmm.
It's going to help people kind of get out of that state of like fight or flight or be super stressed or be like thinking about things all the time. It's going to kind of like pull them back and make them more receptive to sexual acts.
Interesting. Okay.
Yeah.
Well, that's good to know. Yeah, because I feel like some people have been prescribed it, and I can't really tell how
Mhm.
it's working for them, and it might be pretty subtle because it
Yeah.
is kind of one of those natural things that what I relate it to is like when you just kind of get that flush of just like happiness and good feelings when you're, I don't know.
You naturally release oxytocin if you are being hugged for longer than 30 seconds. And that can be with a pet, that can be with a partner. You also release oxytocin after you orgasm. It makes you like feel closer to your partner. So it's that like that warm, fuzzy feeling where you feel in a safe space where you feel like you can trust somebody and
Hmm.
fully relax. And that's a huge part of libido as well.
So, okay, so I'm way interested in like hormone cycles and all of that. I think it would be really interesting if you could walk us through what is actually happening within a month for a
Mm-hmm.
woman. What happens prior to ovulation? Like what hormones are starting to spike and why? And then what happens after ovulation? What hormones are dropping and
Mm-hmm.
why? And why that can create headaches and
Yeah.
migraines and mood changes and all that within a month. If you could walk us through that menstrual cycle, I think
And then,
it'd
of
be
course, it's
awesome.
like all bets are off if you're in perimenopause.
Yeah.
Because you can start to have some wild hormonal fluctuations within that time as well,
Hmm.
right? And so basically, let's start with cycle day one. Cycle day one is the first day of a woman's menstrual cycle. This is typically when your hormones are the lowest. And that's why women feel really irritable. They feel fatigued. They feel headachy. They can be really angry. This is like typically women bleed for 5 to 7 days, and typically all of your hormones are pretty low. And then your hormones start to increase throughout the rest of the month, right? They start to get highest around ovulation, right? This is when we're like priming your body to release an egg and conceive of a child, right? After, so like that's kind of like when women's libido is the highest is around ovulation because all of their hormones are the highest. And then their estrogen and progesterone will usually start to drop leading into the next cycle, right? Their testosterone can kind of follow the same pattern. It's a little bit low around menstruation and then can come up around ovulation. But that's why I also am like, would you feel better if your testosterone was high throughout the whole month? Yeah, maybe. And it may negate some of their PMS symptoms. So
So what would you say causes like extreme migraines?
low progesterone
Low
and
progesterone.
low B6.
Because basically what happens is when the body presents an egg, I think it's the egg that produces a spike in progesterone. And then once that egg releases and like the uterus kind of sheds that, your progesterone just falls off a cliff, correct?
Totally.
Okay. So I'm right.
Yeah.
And that generally can cause those migraines.
Absolutely.
Yeah.
Of course, you want to make sure their nutrients are optimized. Like B6 can typically be really low and that can trigger migraines. But I'm like, all right, what about your iron level? What about your vitamin D level? I kind of want to look at all of those aspects. But progesterone has been incredibly powerful for menstrual migraines. If they're in their 40s and they're now, oh my God, all of a sudden starting to have migraines, it's more of an estrogen issue. So it also depends on what kind of, age group they're in.
Interesting. Okay.
Yeah.
So what would you say are some of like the most common like ways in which you dose progesterone? Like how do you prescribe
Yeah.
progesterone within a month? I've heard different ways of going about it, of
Oh.
just saying, hey, we're just going to take the same amount every single day because it helps me
Mhm.
sleep and all the other benefits. Or are there other regimens that you may have to put people on where they're on higher doses
Mhm.
within month and
Yeah.
so forth?
Back to your migraine question. Think about it. Progesterone is a neurosteroid, right? So it's a very anti-inflammatory to the nervous system. So if you're having migraines and it's creating inflammation in the brain, progesterone's going to lower that. I also really like progesterone for traumatic brain injuries and post-concussions, even in men, because it's a really potent inflammatory for the nervous system. Okay, there's a million different ways to dose progesterone, right? My standard dosage, commercially available progesterone is 100 milligrams, 200 milligram capsules. Do not even take it transdermally. Like that's insane. People are doing it and I'm like, what? And I think because you can like sell it online without a prescription. Cool. If you take progesterone orally, it goes into your blood-brain barrier, and it's very calming for the nervous system. It's going to help you sleep better. It does this because it increases your GABA receptors, right? GABA is an inhibitory neurotransmitter and just kind of like slows everything down, helps with sleep. People feel like less anxiety. They're in a better mood when they're taking progesterone. And I always do it orally, right?
Mm-hmm.
I have some people that are really sensitive to it. They take 50 milligrams. I have one patient that takes 1,400 milligrams a night. And so it's quite a spectrum. And she was like, she's been on that dosage for years. It's the only one that works for her. And so I tried to lower her dosage and she's like, nope, 1,400 is the best. So I was like, there's no negative side effects. What's the negative side effect of giving someone too much progesterone?
Is it true that there's some people that don't handle progesterone very well?
There are some people that don't handle progesterone very well, and they are typically on the autism spectrum.
Really?
Yeah. Mm-hmm. There are a few people that will kind of respond opposite to progesterone. And a really good clarifying question to ask those people is, how did you feel when you were pregnant? And a few of my patients felt absolutely horrible when they were pregnant, like super depressed, like cannot get out of bed. Pregnancy is when your progesterone is the highest. So this is giving me kind of an idea that you're not going to respond well to oral progesterone. And then you might want to think about Vitex, giving them B vitamins just to help their body produce more progesterone on their own. My standard dosing for progesterone is I have people take it day 4 to 28 of their cycle, right? So you take 4 to 5 days off every month, you have a period, you get back on it, and I pretty much will dose them continuously, right? Sometimes people need a little fine tuning, right? I personally do 100 milligrams in the first part of my cycle. After ovulation, I'll go up to 200 milligrams. And I feel like that helps me so much. Other people, especially if we are really trying to optimize their fertility, I only dose it after they've ovulated. Because if you take it before ovulation, I can actually inhibit ovulation. Yeah.
Interesting. Okay.
So I've had several people with kind of like a luteal phase defect where their progesterone levels just weren't getting up there, or they were having chronic miscarriages. Give them a little progesterone after ovulation and they're getting pregnant.
Okay. So I'm curious, now that we've kind of gone over the 28-day cycle and what is happening with the hormonal spikes and drops and why that might be making you feel that way, and also how to potentially use some of these tools / medications to help smooth that out during that time period. But this the word perimenopause gets thrown out there a lot. I know people are trying to understand it, but maybe in your own words, if you could explain to me, what is this thing, perimenopause?
Perimenopause. And I'm so glad so many people are talking about it, because I feel like we all know about menopause, right? We're all just like, oh, we're going to have normal periods until we're 55 and then boom, it's going to stop. We're going to stop cycling. We're going to be in menopause. So I'm so glad people are talking about this and that they're aware of this, right? I'm assuming anyone over the age of 35 is in perimenopause. where we're starting to see some hormonal fluctuations. And what does that mean? Typically a drop in progesterone and testosterone. So many people think that, oh, when they're in perimenopause, their periods are going to get shorter and lighter and more spread out. And then eventually they're just going to fade away entirely. And then they're going to be in menopause. And that does not happen.
Mhm.
Shit gets wild. It's like, I have patients that have 2 periods a month and the periods are now 7 days. So I was like, you've been bleeding for half the month? They're like, yeah, I don't feel good. I was like, yeah, that's terrible. Now they're bleeding really heavily. Now their estrogen is maybe getting really high. Their progesterone's getting really low. I start to worry if they're getting anemic. I had a patient pass out in the shower. She broke her nose because she was bleeding so heavily. And so it can be a really, really hard time for a lot of people. So, I think most women are used to a normal 30-day cycle. Well, now that cycle is shorter. Now they're bleeding every 2 weeks, or now that cycle is maybe 6 weeks. And instead of bleeding for 7 days, they're bleeding for 10 days.
Hmm.
So it just starts to get a little bit irregular. So any kind of normalcy or any kind of anything I can do to get their hormones in a regular rhythm is going to help them so much. And progesterone's a huge part of that.
So, I mean, you talked about all these different things that have happened to some of these patients of yours. I'm curious, what are some of the big telling symptoms that women should look out for in terms of whether or not they know like they're going into perimenopause?
Mhm.
Like, what are some things that they should expect to experience?
Yeah. And anyone in between the age of 35 and 40, they're starting to have irregular cycles. I really start to see their sleep change. They're starting to get a little more anxious, a little more irritable, a little more moody. Their periods start to change. They're getting lighter or they're getting heavier. Some people will start to have skin and hair changes. They're like, oh, my hair is falling out. My skin's thinner and the texture has changed. And then just a lot of fatigue, just feeling tired. And I always ask a really good clarifying question. I was like, okay, so you feel tired? They're like, I'm exhausted. And I was like, do you feel physically tired, mentally tired, or emotionally tired? Like, what is the level of fatigue? Because if they're feeling physically tired, it's a testosterone issue, thyroid issue. If they're feeling mentally tired, it's usually like, do you have some brain fog? Do you need some methylene blue? Do you need some progesterone? And if they're feeling emotionally tired, I'm like, how do I support them emotionally, right? How do I calm down their nervous system? Do they need GABA? Do they need oxytocin? I think that also helps people kind of think about fatigue in a different way.
So I think with the normal 28-day cycle period in pre-menopause, and then kind of the roller coaster, just all over the map, hormone spikes and troughs that are happening during perimenopause. I brought this up on another podcast, but it feels like society has sort of accepted that as just being like, well, that's just how it is. So you just kind of have to live with it.
Right.
And I don't know if that's been your experience with a lot of women, is that they're experiencing these things. And they know it's going to happen to them, but they don't really know that there's things that you can do about it. I think society treats them like, well, it's just part of being a woman. But what I'm finding is that there's so many tools and things that you can do to help women kind of level out the emotions during a month, level out the headaches during a month, and then into perimenopause, helping to stabilize libido, helping to stabilize mood, helping to stabilize just your hormones across that, because it seems like sometimes the gas tank is like super full and then it's just empty within a couple of days.
Right.
So any advice you have for women that are kind of experiencing that and maybe challenging their normal?
So frustrating because I have women that they're like, oh, I went to my OBGYN and I'm telling her I have hot flashes and vaginal dryness, and she gives me Victoza, which Victoza is basically, I correct me if I'm wrong, but I think it's like an antidepressant. And I was like, okay, bioidentical hormone replacement therapy is so safe. Not only is it treating your symptoms, but it's also protecting your heart, your brain, your bones. Certain hormones will also protect you from breast cancer. I feel like, women do kind of accept that you are going to have some changes as you get older, but then there's also a lot of fear using hormones and, using hormones appropriately. And I'm like, this is actually super, super safe. It's super beneficial for you. And it's not only fixing your symptoms, it's helping to prevent other major illnesses down the line. So I think people are becoming more educated and more aware, especially the patients that I see. Right.
What do you think is driving the fear in hormone replacement?
The WHI study where like
which is
the Women's Health Initiative, that was done in like, I think the 70s or 80s. I mean, it was insane. You know, it's been debunked. Like all these women were pulled off their hormones immediately and, you know, everyone freaked out. But when you actually dig into the data is insane how it was misinterpreted and how many women have suffered needlessly because of this study and, you know, how it was like used as like fear propaganda, basically.
Well, it makes you wonder, like I was listening to Peter Attia talk about this and he called it like the lost decade of women
It's
or something
so
like that, where
sad.
there's all these women that
Yeah.
were kind of scared out of utilizing some of these hormone replacement tools
Mhm.
to essentially protect their body going into menopause. And how many of them could have survived longer had they prepared for those years
Yeah.
rather than being kind of scared out of just optimizing their hormones during that whole period of time.
So scary.
Yeah.
And it really is a generation of lost women. And I think this generation is like, they're seeing the data. There's so like, I feel like every week there's a better and better study that comes out. You know, even the studies that are generally in like the medical field, you know, big medical studies, they are using synthetic hormones, right? Which I'm like, oh, you're still getting a ton of benefit using synthetic hormones. I bet you would get even more benefit using bioidentical, which that's pretty much all I use in my practice is 100% bioidentical. But it's wild. And I think there's a couple of really good books about it. You know, there's the new Menopause by Dr. Marie Claire that just came out. And I think more people are realizing it. Oprah just did a huge talk about her experience with menopause as well.
Yeah. Well, so I was looking up because one of the biggest risks with women as they get older is osteoporosis.
Yes.
And just their bone density going down and obviously like being able to maintain your skeletal muscle and your bone density through perimenopause is so important as you carry into menopause. And I started looking up and I heard on the same podcast with Peter Attia them talk about the risks of like the death to women annually from hip fractures.
It's wild.
And I was like, what? So I started digging into it and I start like researching and they're saying something like, okay, hip fractures pose a significant health risk for older women, leading to considerable mortality rates. And I was trying to estimate how many, would act like how many deaths are actually tied to this. And it was something like 300,000 hip fractures happen annually, 70% of which are women. And they estimate that over 45,000 women in the US die each year due to complications related to hip fractures. Hip fractures.
Yeah.
Meanwhile, about 42,000 women die each year from breast cancer. So it's kind of like when you're talking through that study and how they're trying to correlate like hormone use with increased risk of cancer.
Yeah.
The other thing too is they found that back in that study, something like one extra person got breast cancer, but the mortality rate didn't change. So like the number of people dying from breast cancer never changed. So it's kind of a debunked, stupid,
insane
thing.
And
anyway,
still to this day, I have patients that come into my office and refuse any hormones because their sister had breast cancer or they're this or they're that. And I'm like, well, that doesn't really correlate, but they're just so stuck on that. And some of those patients, it's really not even worth me arguing with them because they're so fixated on it. Okay. So that's a hip fracture, right? What about heart attack? What about Alzheimer's and dementia? You know, estrogen is such an antioxidant for the brain that it prevents Alzheimer's and dementia.
Yeah.
You know, there's so many things that these hormones can do to protect our bodies that I feel like the benefit far outweighs the risk, right?
Well, not just that, but even like torn ligaments.
Oh my gosh.
I mean, you start to lose your hormones or you're running on a non-optimal amount for a long period of time, like you're just going to blow an Achilles tendon, you know, and you do that in your older age and you're toast.
There's no coming back.
There's no coming back because your body's not really prepared to heal from that. You haven't, anyway, it's really frustrating. The other thing is in men's health, it's very similar too. There's kind of been this scare about prostate cancer with using testosterone.
The worst.
Yeah. So tell me a little bit about that.
Oh my gosh. I actually work with an incredible urologist who prescribes testosterone because he doesn't believe the hype either. And I actually read a study the other day that showed men with low testosterone are more likely to be diagnosed with diabetes type 2. because low testosterone actually impacts your metabolism.
Mm-hmm.
And so there's a lot of guys that they're like, oh, testosterone can cause prostate cancer to grow. And I'm like, really? There's not a huge correlation. Yes, I could understand if you are on high testosterone, it's converting to DHT. That high DHT level could potentially irritate the prostate, cause a little BPH, but that's easily corrected for using finasteride or duasteride or whatever, right? It's a DHT blocker. But again, I'm seeing that in like 5 to 10% of my patients. I'm not using that medication a ton. So again, I have so many men that are terrified of going on testosterone. And now I've been using a lot more Clomid and Clomiphene. And that's been fantastic because I'm just like, I want to keep your testosterone levels. You don't need to be where you were at when you were 21, but I at least want to keep you out of like the red zone, right? Mm-hmm. And then I have so many men that they're like, oh, my doctor said my testosterone's normal. And it's like in the 300s. And then cutoff is like 280. Mm-hmm. I'm like, it is in a normal range, but it's definitely not optimal. And so those guys, I'm like, let's just do a little Clomid and Clomiphene, get you into like the 600-700s. If you want to do full testosterone replacement, that's an option as well. But it's really, I have so many guys that putting them on testosterone has changed their lives. And it's like, I talk to their wives. I usually see like a lot of couples talk to their wives and they're like, yeah, they come home now. And instead of laying on the couch for the rest of the night, they're playing basketball with their kids. They have the energy to help me around the house. I'm not as resentful. Maybe now they're having more sex because now she's not as resentful that he just lays around all the time. So for so many guys, it's really a powerful like therapeutic.
Yeah. And even going back to that study that some people have used to correlate
the prostate cancer
with testosterone, is it was really a crappy study. And this was way back in I think this was like back in the 30s or 40s. It was really, really old. Mm-hmm. And I think it was something like they showed that someone with zero testosterone had less chance of prostate cancer than someone with a small amount of testosterone. And that was their conclusion, that it was correlated somehow. But they also showed that those with normal levels of testosterone, it was actually neuroprotective, cancer preventing, heart, and all the other things, heart. Yes. And then you just probably saw that the who just took it off of it had been labeled a potential heart risk.
Yeah, the American Cardiovascular.
They just removed it. Like I think in the last couple of weeks they just removed that, which is huge because now they're showing that actually it doesn't have negative cardiovascular. It probably actually is protective of the heart. Yeah. Whereas if you're running at really low testosterone for a long period of time, you're probably doing way more damage.
Damages your heart. And there was a study that showed low testosterone can actually damage your prostate as well.
For sure.
Because your prostate is very dependent on testosterone production. Mm-hmm. There's so many things that really impacts and think about it, your heart is a muscle, right? So if your testosterone level is low, your heart may be weaker than normal.
Yep. I'm a big believer, at least on the men's side of things, optimizing testosterone for a lot of reasons, especially if you're busy, working professional, have a family, have a wife, because like if your hormones, I tend to put a big emphasis on symptoms over blood work. I think blood work's really important. We do a lot of it, but I think that's more of like a map to help providers like figure out a right treatment for it. Yeah. But when you say someone comes in and says, well, my doctor did my labs and I'm normal. Well, that doesn't necessarily mean you're optimal, right?
Normal isn't optimal.
But when you optimize your testosterone, at least I know for a guy, you feel so much better. You feel so much more productive,
you sleep
way
better.
More drive. But I can tell you, my wife appreciates it a lot more because there's been times in our marriage where I know that she doesn't feel maybe desired, even though I love her to death, right? Yeah. And you know her.
She's a literal angel. Yeah,
and she's like freaking hot. Of course I love
Stunning,
her. And
perfect.
Of course, but there's something about it when you have optimized levels of testosterone, you're going to be a bit more handsy. You're going to want to help out more. You're just so much more like, it's just that male instinct. And so I'm telling like guys, like if your levels are normal, but you're symptomatic, like just trust me, you're going to feel and behave a lot better Like the man that your
Do you
wife
feel
needs.
more like alpha?
You
when
feel,
you're-
you definitely feel more alpha, but you become kind of the man your wife needs you to be. If that's what,
That's
just
actually
to be.
a really beautiful sentiment. And that's like typically what I'm hearing from my patients as
Yeah.
well, that they're like, oh, he's so much more helpful. He's in a better mood. He's has more energy. He's, not as like reactive. So,
But I think it's important to make your spouse feel desired. And if your hormones are off, you're not naturally just gonna, even though you love them, you're not gonna feel like inclined to be that way.
yeah.
But when your hormones are optimized, you just are that way. Like it's just how you are.
love that.
So anyway,
I love that story, that personal.
do you love that from me?
I'm sure Stephanie loves it.
Anyway, so I'm curious though, like we talked about perimenopause and kind of the roller coaster that women go through during that period of time. What advice would you have for men that are living with a woman that are experiencing those things? Because I think sometimes men might feel like they're not being desired, or because there's libido changes and there's stuff like that going on.
Totally.
What advice would you have for men that are living with a woman that's kind of going through those things? Like what things should they be aware of? How can they be more helpful in understanding of what the woman's going through?
Man, I don't know. I feel like communication is very important because I think people take things personally, which doesn't need to be taken personally, right? She may be like, not tonight, honey. And you're like, oh my God, she doesn't like me. Men tend to like spiral like that sometimes. And it's just like, she may be exhausted. She may be laying in bed thinking about the millions of things she has to do. So I would say take as much off her plate as possible, help her in any way possible, make sure she's eating well, make sure she's exercising. If you feel like her hormones are really off, send her to go see someone to balance her hormones. I don't know. What do you do for Stephanie?
Well, okay. So the reason I brought this up is because I was thinking through the topics to go through with you. And I just thought, man, it would be good to look at things from a men's perspective a little bit, because I'm sure there's a lot of guys. I mean, it's natural human behavior to maybe get a bit insecure when your wife is not into you, or to feel like she's really mad at you for no reason. I mean, you hear guys experience that a lot.
Yeah.
But
and
I
a
think
lot of guys take it personally
they
and it has nothing to do with you.
Exactly. So that's why I thought it'd be interesting to bring this up, just so men know what's going on or potentially going on, so they don't take it personally. But the other thing that's pretty staggering statistic is really the average age in which men and women get divorced.
Yeah.
And I brought this up to you earlier, and I don't know if there's a correlation here, but it literally is like at age 42, 43, 44, which is when you're right in the heart of massive hormonal changes.
That's the age of women or the age of men?
Both.
Okay.
So 42 for women, 45 for men is the median age. So it just made me wonder, like, how many relationships are getting kind of like torn up because they're not figuring this out medically, and they're just kind of going with it. They don't really know why they're pissed off. They don't know why my wife hates me. They don't know why they have no interest in having sex with their spouse. Like, how much of that could potentially be alleviated just by simply going and having things checked out and seeing if there's some really low maintenance, subtle things that you can do to just like feel great. Yeah.
I love that you're thinking about this and that you're like correlating this to like hormones and life changes and all of that sort of thing. And it's really funny. A lot of times I will start to see the wife or the husband of a couple, and then I'll end up seeing both of them, because once one is optimized, the other one will kind of be lagging behind, right? And then they're like, oh no, I want to feel as good as they feel. So then a couple months later, they'll come in and see me as well. And, it's kind of like a time in people's lives where like maybe the kids are getting older, the kids are like moving out of the house maybe, and then people are starting to see major shifts hormonally. Women, their hormones are starting to decline. Men's hormones will start to decline as well. So I always tell men, I want to get their labs. Like, I want to see what your baseline testosterone is in your 20s. And they typically don't come to see me until they're like late 30s or 40s. I'm like, okay, well, we're going to just run your labs and see where your testosterone levels are now. Same thing for women. I was like, I want to see where your testosterone levels are and where or they can be optimized, because I feel like testosterone is such like a relationship maker or breaker. And then just also nervous system regulation with the progesterone. But I'd be super curious. I've had a few patients that they're like on the verge of divorce, and then they're like, they come into me as like a last ditch effort. And I'm like, okay, I'm not a relationship therapist, but I can work on your hormones and we can see what we can do. And it's kind of like a 50-50 toss up if they stay together, if they don't.
Well, yeah, you can't fix everything with just
I know,
that.
with like hormones.
There's the emotional side of it, and there's it's way more complicated than that. But you never know if like one thing triggers the other thing that then triggers, like contentment for the other side.
Totally.
That all could have started when the hormones get out of whack, right? And I just wonder if a lot of that could be prevented. I don't know. In many cases, obviously.
We should open a clinic that is like hormone and marriage counseling.
Interesting.
Okay. That's our next $1 million idea.
All right.
Okay.
We'll put a business plan together. Okay. So what was I going to say next about hormones? I think that's about it on the hormone side. I could have way more stuff.
Dude, hormones are so fast. And more people are talking about them now, which I'm so glad.
Well, a lot of people never got them checked. I didn't get mine checked till I was 39, which is still seems probably pretty early for a lot of people. There's a lot of dudes out there. Well, I'm saying for a lot of people, they feel like, at least in my circles, it feels like it's something you don't do until it's really weird because my experience, I've always been health conscious. I've always gotten physicals every year.
Totally.
I've always tried to stay up on things.
So what do your physicals consist of?
But that's what I was going to say.
Yeah.
It's like for so many years, I worked for a big corporation and they had one of the best like annual wellness checkup programs I've ever seen in my life. It was a 4-hour checkup once a year. They would take me to a nutritionist, blood work. I'd do cardio stuff, vision, hearing, the whole thing. And then after 4 hours of going through all this stuff, then my labs were already back. They had a lab there. They'd run the labs.
That's so nice.
And then the doctor would go through labs with me, but it was like
if they're running labs on site, they're running a very, very
it was just a basic metabolic lab.
Very basic
and they never checked my hormones.
Correct.
And finally I started getting into like my mid 30s. And I remember asking the doctor, like, well, could I get my testosterone checked? And he's just like, no. He's like, you're athletic, you're fine. Because he could just look at me and he's just like, no, I can tell you're normal. And I was like, well, what if I want to know? He's like, well, your insurance doesn't cover that. And I remember just thinking like, this is kind of weird. Like, why is that?
Well, I'm getting insurance to cover it.
Well, I don't know why. Maybe mine at the time, their wellness thing, I can't explain it, but I think there's a lot of people that are trying to take care of themselves, but they don't really know what's going on with the hormones because it's not checked that much because they're checking just the basics
I think a lot of people are under a false kind of confidence, or they're under this kind of illusion that they go to their doctor every year and their labs look great. And then boom, they die of a heart attack.
Yeah.
Right. But they're like, oh, but my labs look good. And I was like, a general primary care provider is running a CBC, a CMP, maybe a cholesterol panel, maybe a TSH, T4, and maybe a vitamin D if you're lucky. And then I was like, they're not looking at like your sex hormones. They're not looking at micronutrients. They're not looking at inflammation markers either, which inflammation is really like the predictor of cardiovascular disease way more than cholesterol. So they're under this like false assumption or this false pretense that they're like super healthy and they're not.
Yeah. So what would you say is the number one way in which you've helped women with low libido?
Testosterone,
right?
Totally.
And what about for men?
Testosterone.
Same, right?
Also testosterone.
So I asked that because I think it's really interesting how testosterone has been a bit taboo for women. I think they see it as being like androgenic and like I'm going to grow like face hair and I'm going to become muscular. How would you debunk women feeling like they're going to become masculine on testosterone?
There's a fantastic book called The Secret Female Hormone, and it is written by a medical doctor. It's all about testosterone replacement in women. Women actually produce more testosterone throughout their lifetime than estrogen.
When you convert it, right? Because they're different. Yes. They're different measures.
Ratios, totally.
Yeah. And once you do, they've got more in them. Yeah.
I think women think, oh, I'm going to be doing injections and like all these like high doses of testosterone. And I was like, no, you're at like 1/16th of a dose that I would give to a man, right? You are at a very, very small dose, and we are just trying to optimize your levels. Most of my women, my testosterone range is like 20 to 40. They're at like 21. I was like, you're 1 point in a normal range, right? I would like you closer to 40, and then of course that's total versus free. I want your free testosterone on the higher end of normal too. And women generally are like, oh my gosh, they have this like confidence. They have this like zest for life back. They just feel so much better overall.
Yeah. That's good. No, that's exactly
Yeah.
what I've seen as well. And I just think there's been some weird taboo about it. I think there's a lot of women that are scared of testosterone because they are afraid of like the side effects. But to your point, it's they already both men and women have testosterone.
Yeah.
And women do produce more testosterone than estrogen over their lifetime, which is something I actually just learned as well. But no, that's super interesting. One other thing that I was thinking about just came to mind was women with UTIs and how
Oh my
how
God.
is estrogen and DHEA, like vaginal estrogen and
Yes.
DHEA, used for women that have like chronic UTIs?
I'm so glad we're talking about this because there was a study that came out about a month ago that vaginal estrogen was approved for patients that have active breast cancer. So, like, I have women that are like fully menopausal, right? They will not touch any hormone because it's going to give them cancer. And then they have like 2, 3, 4 UTIs a year. And I was like, you've been on antibiotics 2 or 3 times a year. You've wrecked your gut. Now we're wrecking your mitochondria because you've been on so many antibiotics. And I was like, this is so safe. This is so effective. It's called menopausal genitourinary syndrome, where all the vaginal tissue that is highly estrogen dependent because becomes so depleted of estrogen, you can actually get tearing and like burning pain, and you getting urinary tract, infections. And I was like, this is such a simple, effective treatment. It is super safe. It is safe enough that you can give it to people that have breast cancer. Why wouldn't you take this? So it takes a lot. I feel like half my day is just like convincing people to do very safe treatments that they are so like mentally blocked against. So
yeah, it almost seems like almost every person, every female that fits that age category should be on some sort of a dose of
there
estrogen.
is some staggering statistic that if women just did vaginal estrogen cream, you do a loading dose, right? You do a loading dose, you do it every night for a week or two, and then you just apply it 2 or 3 nights a week. It's really not that big of a deal, but it would save. So one of the number one causes that women die when they're in their 80s and 90s is they get septic.
Right.
And they get septic because they get urinary tract infections that they do not feel. They do not realize is a urinary tract infection. It gets into their kidney, gets into their bloodstream. There's no pulling you back from that. Right.
Mm-hmm.
So there's a staggering statistic that just using vaginal estrogen 2 to 3 nights a week into their 60s, 70s, 80s, 90s would save so many lives.
Yep.
It was wild.
And it would save a ton of money. I think in the healthcare
it would save
system.
Medicare trillions of dollars.
Yeah. All right. Yeah. That was the one thing that just kind of popped up. I was like, what about these UTIs? Because I do remember listening about just kind of how when estrogen drops like that, it kind of screws up the kind of the female body's ability
tissue,
the healthy bacteria that's in there, because there's a ton of healthy bacteria in there, and if it's not properly regulated through estrogen, then you don't have anything in there to fight off the bacteria that's then can potentially make you septic.
But then think about what it actually does to the vaginal tissue, right? The vaginal tissue actually starts to shrink and it becomes like almost fibrotic. So you're not able to fully eliminate the urine. Maybe you're having like some urinary retention. I mean, it just turns into a whole kind of mess, in their pelvic floor. So, and this is available at your commercial pharmacy. You just need to ask someone to prescribe it to you. I, of course, prefer it to be compounded because I prefer the bioidentical. And then I have a lot more patients asking about it now because they also want it as a skin cream.
So did you say that the vaginal tissue shrinks?
Yes.
So
you like lose your labia.
So what if the male anatomy shrunk? how would
Oh my gosh, there would be
how would
like
society react
riots.
to that?
Yeah, there would
Yeah.
be like 50 million medications.
Exactly. That's another thing with female health that drives me nuts. And
I
I
think
want to
you're
bring
like
as much awareness to all this stuff as possible, because I just think it's been understudied and underrepresented. And
I think you're like a secret feminist.
oh, I totally am. We already said, my wife, like, got to keep her safe and protected and healthy.
I love it.
Let's shift gears a little bit.
Sure.
How much time do we have? Jeez, it could go forever. All right,
know.
we'll try to wrap things up soon. I was just curious with GLP-1s, talk a lot about those, but I had asked you earlier, like, the non-weight loss uses for GLP-1s are really interesting to me.
Yeah.
Obviously, talk about weight loss all day long, but I'm really curious, like, how GLP-1 medications have like really transformed the lives of those that are suffering from PCOS and or other things that you've seen.
I have so many PCOS patients that I have them on a very low dose. I've like microdosed them, that their periods are normal for the first time in their lives. That they would have periods like once every 3 to 6 months. Now they're cycling every month. And I'm like, wait, what? What else did we change? She's like, that's it. So that has been super effective. Think about the root cause of PCOS is insulin resistance, right? At the ovary. And that's what semaglutide and tirzepatide are fixing. So if we can remove that insulin resistance or improve the insulin resistance, now the hormones can actually have action on the ovary.
So is this why you would say fertility rates have kind of that they found that correlation between fertility?
So this is such a good question. Okay. So now there's like all these like Ozempic babies, right?
Mm-hmm.
Semaglutide, which is Ozempic, is contraindicated in pregnancy, right? And a lot of fertility clinics do not want you on it while you're going through fertility stuff, right? But I was like, but it makes the ovary more receptive to the medication. So I like kind of was like butting heads about that. But I literally have seen people that they were told they were never going to be able to get pregnant, get on semaglutide or tirzepatide, and then boom, all of a sudden they're like accidentally pregnant. And I'm like, oh, holy shit. And then I freak out because I'm like, how much have you been injecting? Or like, when did you find out you were pregnant? And they're like, oh, like 2-3 weeks ago. And they've been doing injections and the kid always turns out fine,
Of course.
Yeah. But that has been so powerful. I just like, I do so much blood work that when I start to see changes in the labs, I know we're changing the physiology, and I'm measuring people's inflammation markers. I'm measuring their insulin, and I'm like, this is such a powerful drug because it is affecting almost every system in the body. I mean, it's really incredible what this medication is doing.
Are there any other like non-weight loss things
so
that you've noticed?
inflammation, right? I had a patient, and in her 70s, she's like, I can bend over, and she has dogs, so she's like, I was bending over the other day, and I noticed that I could bend over, my back doesn't hurt. And my Hashimoto's patients, their autoimmune markers are getting better. Their CRP markers are getting better. So I'm measuring all of these inflammatory or these autoimmune markers, and every time I run them, they get like better and better and better.
Do you find that a lot of people on GLP-1s mention that they just have a better sense of well-being?
Yes and no. Sometimes people feel really depressed on them.
Really?
Oh my gosh. Yeah.
That's been a side effect you've noticed. Okay, interesting.
And I'm like, okay, but like, as long as you're not feeling suicidal, like you adjust. But a lot of times people do feel like a better, I don't know, they just feel a little bit clearer mentally. They feel more mentally, they have more like mental capacity. Yeah.
Yeah. Well, yeah, I've heard, I think because of the inflammation, you probably might see some lower inflammation in the brain, which would help with just like focus and all the other stuff, happiness. But I feel like more people than not that I talk to just generally, they can't explain it, but they have more energy and they just have a general better sense of well-being. But,
yeah.
I haven't heard of too many people that have experienced depression, but
I know. Then just move them to Tirzep and then they're fine. And then, give them some methylene blue and then they're like, oh, I feel better.
Got to mix it. Are there other types of medications that you find are really popular to prescribe with GLP-1s that really tend to enhance its
I very
benefits?
rarely give GLP-1s on their own, right? Because I also, when I'm like approaching a patient, I'm approaching like their whole body, right? My biggest fear is that you're going to lose muscle on a GLP. So I am generally giving it with testosterone if it's appropriate and if their labs are low. I also love Semorlin, right? That is a growth hormone releasing peptide. Typically, as people are kind of like getting towards the end of their GLP journey, they're kind of getting close to their like goal body weight, I like to do a 90-day cycle of Somorelin just to work on their final like body composition, have them put on a little muscle, lose a little more visceral fat. That's been really powerful.
Okay. No, that's awesome.
You know,
What would you say are 3 supplements that every single person should take every day?
oh my God.
Just 3.
B vitamins,
Okay.
vitamin D, fish oil.
Okay.
That's it. Maybe a probiotic.
I said 3.
I know. It's just like, it depends on the person and like
Maybe
what's going
3.
on with them. Is it do they have gut stuff? Are they inflamed?
It's hard to narrow it to 3
Yeah.
because you got to have magnesium too.
Magnesium. You know, the big, you know, I saw 12 patients today. I reviewed 12 labs today. All of them had low B6 or low B12, like the B vitamins always need support. And then I'm always just giving people vitamin D because vitamin D really acts like a hormone in the body.
Mm-hmm. And a lot of women are low in vitamin D.
Oh my God, everyone's low. We live in Arizona, dude. How are we low?
Yeah.
But we never go outside because
Do you prescribe it or not prescribe it, but recommend it with K2 or just
I don't care.
D? Doesn't matter?
I don't care.
Oh,
Please just take it.
Yeah.
Just take it. Look. Yes, it's better with K2, especially if you're high dosing it because they're saying that the vitamin D stays more in the bone than the artery. I'm like, I have yet to find any studies that really support that.
Oh,
so at this point, I'm just like, just take it. I don't care.
Okay. Well, any advice you have for me to optimize my health?
You're living the dream.
You think so?
I think so.
Mm.
What are your concerns? How can we make you better?
How can you make me better?
What are your health goals?
You just being here made me better, and I appreciate you coming. And I think you and I need to do this again.
What a pleasure and a joy.
Because we could talk about
we got to talk about NAD, we got to talk about glutathione, we got to talk about methylene blue.
So this was kind of our
Hormones.
Women's health / we didn't even really get into men that much. There's a lot there too.
Yeah.
But I think it'd be good to talk again and maybe get into the anti-aging side of things.
So fun.
And then maybe we can get into like the derm side of things a little bit on the anti-aging
I love derm
side of thing.
Yeah.
Just love derm.
I love derm.
But no, I honestly think we got through some good stuff here. And thanks for coming in. I know it's a little late and you had all those patients today and you're probably exhausted.
That's okay.
And it's the weekend.
I know.
A long one at that.
I know.
Happy
I was
Memorial
like,
Day.
why did we schedule this?
Why did we schedule
this at 5:00 on a Friday?
It's because you had a busy schedule.
I know. It's hard to pin me down. I know.
But thank you for coming in.
What a joy and a pleasure. And I'll come back anytime.
Okay. Thanks.